Now, in this video, we are going to discuss bleeding disorders. Now, what is a bleeding disorder? Bleeding disorder is a condition in which there is bleeding on more than one occasions from more than one sites. So let's see if a patient has epistaxis, a recurrent epistaxis. That doesn't mean a bleeding disorder. That may be a possible anatomical abnormality in the nose of the patient causing recurrent bleeding. So that would not be a bleeding disorder. Similarly, if the patient suffers from toxicity of an anticoagulant, this may result in bleeding from multiple sites. So this may not be a bleeding disorder. A bleeding disorder by definition is that there is bleeding on more than one site on more than one occasions. Now, when we see a patient who comes with abnormal superficial or deep bleeding, let's see how we proceed. If this is superficial bleeding, most likely this is because of the platelet abnormalities. Sometimes this can be abnormalities of the collagen tissue, for example. Vitamin C deficiency may result in bleeding in the superficial areas, especially under the skin. When there is low platelet count, look for the presence of ITP, marrow failure, malignancies, consumption, sequestration, DIC, or hypersplenism. So there may be destruction, low production, sequestration, and consumption of platelets. If the platelets are normal, then there may be platelet functional defects, which may be congenital, for example, the Glanzmann purpura. There may be von Willebrand disease, or there may be factor 13 deficiency, and some of the patient may also be affected by the drugs which cause functional problems in the platelets like aspirin. And if there is a deep bleeding means the bleeding is in the joints or muscles, while superficial bleeding is from the skin and mucous membrane. So this may be different from. Then we do a PT and APTT. If the PT, APTT are normal, this is possibly functional defect of the platelets again. But if they are abnormal, we go for the mixing studies. If the mixing studies do not correct the bleeding tendency or bleeding disorder, this means there is either a factor inhibiting the clotting factors, for example, antiphospholipid syndrome, they may be inhibiting the clotting factors, or patient may be on anticoagulants. And then if it is corrected, we go for more specific studies. For example, if the patient has high PT and APTT, this may be factor 5, factor 10, factor 2 deficiency. Oral anticoagulants, vitamin K deficiency, and liver disease may be one reason, and DIC may be another reason. And if a patient has normal PT but high APTT, this is factor 8, 9, 11, 12, and prekallikrein deficiency. There may be lupus anticoagulant which may be present, and von Willebrand disease can produce similar defect. And then if the patient has abnormal PT while the APTT is either normal or it is high, this may be factor 7 deficiency, vitamin K deficiency, this may be liver disease, this may be patient is on. And then if we see patient has abnormal PT, abnormal APTT, and there is abnormal TT, that is thrombin time is also abnormal. This is fibrinogen deficiency or fibrinogen disorder, this may be liver disease, or this may be patient is on heparin. So this is what we see. And now we do the mixing studies. What are mixing studies? We mix aged plasma or adsorbed plasma with the patient's plasma and see what happens. Aged plasma lacks factor 5 and factor 8, while the adsorbed plasma lacks factor 2, factor 7, factor 9, and 10. The adsorbing agent usually is barium sulfate. Now we see what happens when we mix these. When the PT, APTT are normal, there is no deficiency of clotting factors. But we see if the PT is normal but the APTT is abnormal, and it is corrected by both adsorbed plasma and the aged plasma, this is factor 11 or 12 deficiency. When the PT is normal, APTT is abnormal, it is corrected by the aged plasma and not by the adsorbed plasma, this is factor 9 deficiency. With a normal PT and abnormal APTT, if this is corrected by adsorbed plasma and not by aged plasma, this is factor 8 deficiency. So if we've got abnormal PT and normal APTT, this is not corrected by adsorbed plasma but corrected by aged plasma, this is factor 7 deficiency. If you've got abnormal PT, abnormal APTT, this is not corrected by anything. This is factor 2 deficiency. If we've got abnormal PT, we've got abnormal APTT, it is both are corrected by adsorbed plasma but they are not corrected by the aged plasma. This is factor 5 deficiency. And if we've got both PT and APTT are abnormal, they are not corrected by the adsorbed plasma but they are corrected by the aged plasma, this is factor 10 deficiency. So this is how we can find out what factor is deficient in these patients.